Hi there, I'm Mabel Jung, and you're watching the World Healthcare Congress Interview Zone. And I am so pleased to welcome John Holcomb to the chair. He is Vice President of Healthcare Operations for Target. John, it's great to see you.
Thank you for having me.
Well, it seems like Target does a lot of things well. Why get into healthcare as well?
You know, we've been in healthcare for over 50 years and as a company, and there's really several facets of healthcare that we're in. So if you think about it from a mom's perspective, moms over time have been telling us healthcare is our top priority. So we've continued to try to look through the eyes of our consumer to figure out how can we provide solutions for her. Second is Target is an employer of over 360,000 team members. So we spend a lot of time thinking our team members are our greatest asset, because without great team members you don't have great service in our stores. So we spend a lot of time thinking about how to engage with our team members and make sure they're on the path and stay on the path to health. Third is our communities that we're in. So as you know, Target gives back 5% of its profits every day to its communities, which amounts to over $4 million a week. So as we think about our consumers, we think about our team members, we think about our communities, you add all those three together, and it creates a great business environment. So healthcare is core to what Target does for all those reasons.
Well, you have said, or I've read this, that healthcare and retail actually share a lot of the same components. Can you expand on that?
Oh, absolutely. And so one of the things as we think about is the eyes for the consumer. So as you think about in a retail experience, what is a great retail experience? It is when mom comes in, and mom's typically our guests who come in to shop our stores. She comes in, she walks the store, she finds the product she's looking for, understands all the trade-offs between price and value, between the different options, and she can confidently select an item that's going to satisfy herself and her family's needs. When you think about the healthcare, it's basically the same story. She comes in to find a healthcare product that we put together, an assortment. So first thing is we create collective assortments and make it easy for her. So for example, we put all of the blood pressure treatment things in one section, from monitors to daily aspirin. We do the same things with kids' vitamins. So we create an assortment that helps her understand and navigate what does she need for her family. The second thing is we provide great in-store team members to help them. So in this case, in the pharmacy space, we provide great pharmacists and clinicians. In the rest of the store, we have team members that are accessible. So it's really the combination of a great assortment with the accessibility of team members to answer questions that creates that magic in that guest experience.
So it seems like it's a natural fit to really have healthcare in retail.
Yes, yes it is.
So what are some of the things that you can offer as lessons to the industry in general that needs to be done better based on the experiences that Target has had?
No, great question. So starting with your consumer focus, right? Thinking about, for us to be successful, mom has to be successful. So starting the journey through her eyes. And then asking questions how you're doing. We spent a lot of time asking our guests in our stores, how are we doing? Was the service where you want it? Did you find the products? If you didn't, what can we do better? So as you think about evolving your experience, if you have a great experience, you build trust. Trust builds loyalty. Loyalty gives you the ability to ask questions and innovate. And then you take those things you learn and build them back into your experience. So it's that constant consumer focus about how do you do great things for mom and simplify the things that she needs, and asking questions along to continue to evolve.
Now that we're going to be seeing exchanges come online in the healthcare sector in October, are these some of the things that can be applied actually to the exchanges? Talking to consumers more, finding out what they need to get what they need, and then applying that and making that information available more easily.
I think when you think about the exchanges, it's really a two-step process. One is to understand and connect with the consumer to help them make a smart choice as they choose an exchange product. The second step, which healthcare is evolving to, is helping people know how to use their product, know how to use the exchange product. So I like to give you an example, Legos. So if you're out shopping for your son's 9th birthday, and you want to find a Lego kit, and you look and you come to the assortment and you say, okay, I got 3-year-olds, 5-year-olds, 9-year-olds, and 12-year-olds. Great, I know exactly which product I want for them based on their age. But what if you get it home and it doesn't have an instruction manual? Right, you find yourself completely disengaged. The exchange is going to be the same way. If we do a great job helping people select a product, but we don't show them how to use it, right? That's the piece where we have to continue to stay focused. That's where Target's guest-centric attitude, I think, is going to play well in the post-exchange world.
How deep into the organization is healthcare? Do you also spend a lot of time talking with your team members about health and wellness and build that into the culture as well?
No, that's a great question. A few years ago we started talking about health within Target, and what we realized is there's a lot of things that go into health besides health. And that actually took it up to the level to say, how do we focus on the person? How do we continue to help support our team members across all facets? And what we found is health was one of 5 main pillars. So you have health, you have social, you have career, you have communities, and you have financial. And what we found is all 5 of those play a role in our team members' well-being. Now, when you actually say, how do we help our team members get and stay healthy, that focus shifts into prevention. So from a preventative perspective, we've been covering, long ahead of reform, 100% preventative care for target team members for several years now. We also pay for every one of our team members, whether they use our insurance or not, to get a flu shot. We encourage biometric screenings, and we also have a Be Well at Target, which is the online coach that allows you to set goal setting. So team member health and engagement is really important to us, but it starts at the top, at our CEO and our EVP of HR, and they set the permission to really engage around those attributes, around the Be Well. But really the magic happens at the store level, at the local level. So they set the permission, the magic happens at our 2,000 wellness captains that are in our stores and distribution centers and headquarters. And they're the ones who actually help team members find ways to connect with what's important to them based on where they live and work.
Any thoughts on providing on-site clinic services, perhaps one day at Target? Might we come in and actually be able to see a doctor, for instance?
Yeah. So recently this year we've rolled out an on-site clinic with physicians, and we're really in the test and learning process around how is that experience going to evolve, how are our team members going to use it, what role is it going to play. And that's in addition to the clinics that we have in our stores, which obviously our team members can use anytime they want.
Okay. All right. John, is there anything that I've missed? I'm sure that there are a lot of people who are interested in the Target experience. Yeah. What would you leave as some of your final comments? You know,
when you think about it, and I want to build on your comment about experience. When you think about experience, it really, there's several things to having a great experience. And really that starts with simplification. When you have somebody that's looking for products and services, make it easy for them to find, make it easy for them to understand the trade-offs, and make it easy for them to have a confident purchase decision. The second piece is the engagement. Find ways to leverage tools and technology in addition to the team members in your stores to personally connect, develop that bond. And then third is find great partners. Don't think you have to do it all. So once you've found a way to simplify the experience, engage the people that are in your stores, and if you need to have great partners to help round out that guest perspective, again with her lens on, that's the secret to having a great experience.
All right, John Holcomb, thank you so much for your time today.
Well, thank you. Thanks for the opportunity.
A pleasure.
Pleasure.
I'm Mabel Jung. Thanks so much for watching.